Okay, so here is the laundry basket, and I have one pillow on it, and next thing I need to ask you to do is you can pause this long video and watch the TVA video. What is transversus abdominis, the deep core, and how to activate it. And the reason why this is going to be your lifeline. So that video explains how TVA is the deepest of the 4 abdominal muscles, and it inserts right into the thoracolumbar fascia, basically stabilizing your vertebrae. And in order for you to change your position with less pain, you want to engage TVA. So you're going to want to first learn what it is. I talk and explain that muscle. Then I teach you how to activate it. The first video teaches you about TVA sitting upright, but you're not going to do it while I'm saying, okay, let's feel where it is. No, do it lying down. And the second video is really how to really get that guy turned on, and that is lying down. And I want you to practice that before we even move on. So you can pause this video and watch those. TVA is going to act like a back brace for you. And it's going to, give you that protection and allow the brain to give you permission to move a bit. Because right now, when you go to move, the brain is gets the pathway of pain signal, and it creates muscle guarding, muscle spasms to splint the area. And then those muscle spasms are what's seizing, taking your breath away. So we want to minimize that emergency signal by activating the TVA muscle to help support you every little movement you do. You're going to always go to lie from your back to your side by engaging TVA 1, and 2, using your arms and legs. So you want to avoid twisting. So if I'm lying down, like let's say I had to get down from here. So probably you wouldn't have sat like I did, but you might have come from standing, someone helped you to get to here. I'm on my side. Now I'm going to engage my core, and I'm going to use, it's like I'm trying not to move here. This is what you're trying to protect. So you want to splint this, and you want to avoid twisting through your low back. So you'll engage your core, and you want to keep this guy like a unit. So I would be moving like this. I would try to keep my core engaged, and my hands and legs are going to do everything. They're going to take all the weight. Maybe I get to my elbows. And what's allowing me to do that move is that core TVA engagement. Your arms are strong, stronger than you think. Your legs are strong, they're healthy. So you're going to use them to protect and splint here. So then I would lower myself down, I'd keep my core engaged, and then now to move from here to my back, I would use my hand, right? And my knees, and then use my both hands, I don't know if you can see it, are pushing, and I'm trying to get to my back. And that probably hurt, but any motion, movement, you brace here and you use your arms is my point. So if you can get to here, which is called Hookline, your feet are flat, your knees are up, and you're on a couch, floor, or bed, it would be awesome if someone could, see I'm weight down on one leg, and then I'm gonna engage my core, and I'm gonna pick up this leg. And it would be great if someone was here to slide the ottoman under me. But if not, thanks to my friend in the laundry basket idea, I can hook my foot and move it a little bit closer. And then I can, how far away am I? Still kind of far. So I'm gonna remember what it was like. So for me, I would actually, because you don't want to lift and get your butt closer, I would have you turn to your side, cores engaged, and I would scoot my tushy closer to the laundry basket. And then I'm going to use my hand. I'm not letting this twist. And I can put one leg up while this leg braces, and then that leg up. And then cores engaged. And I could use my arms. And it's not going to look pretty, right? But once, and if you have help and someone can support a leg, sneak the ottoman in, oh my God, it's so much better. I've been in both places. I've been by myself and not able to move, and I've had now my husband able to help, and you know, it's helpful to have someone. So if you have someone you can call, a friend, a neighbor, by all means. Okay, so what are we looking for? We're looking for the 90-90 and the ottoman. So for me with this guy, I'd have a friend and I'd add an extra pillow. But this is okay. If this is what I had, I would not get up to get another pillow. I would stay here. And gravity is helping reduce the spasms in this position. And it takes 20 minutes in this position for the discs to reabsorb their fluid. You might not be able to tolerate 20 minutes, but if you can do 5, 10, 15, great. If you can do 20 and you're here and you're like, oh, I feel so much better, great. Ice under your back would be ideal. The only time this isn't okay is if it's increasing zingers down the leg. Getting there might not, that doesn't count. But once you're here and you're really in that 90-90 position, those zingers should go away. Even severe disc herniations, which I've treated hundreds in my clinic, once we're here, usually it's a good position. There is a few percentage of people that's not the case, so then you wouldn't be here. All right, so the ottoman position, getting there is funky, try to get help. But if you activate your TVA, you will be able to do it. It won't look pretty. The other thing, I'm going to move with ease now and kind of come out of my back pain crisis and see how I just kicked it away. This is called Hookline. This is a good position for you. You don't want to lie flat if you can help it. If this is the only position that gives you comfort, then great. But usually it does not feel good. And you want your knees bent like this, and you can have pillows stacked under your knees. That's different than the ottoman position. This is a different force and mechanic engineering in the low back. So, but you're not gonna stay all day in the ottoman position. So go back and forth, ottoman to this, to going on your side. Now to turn on your side, again, hopefully you'll probably have a nice comfy pillow under your head. But you're going to really engage your core. You're going to brace, and then you're going to start to begin to reach here and move simultaneously, right? So no twisting, no. This arm and this knee are going to move together, and I'm going to brace, and then I can use my arms without moving here at all. So TVA will get you to your side. Now, my next request of you is as soon as you can, it might not be day one, but if you can do it day one, it's ideal, is to get to your stomach. Getting to your stomach, there's a whole video on it, but I forgot how bad it is. And so on that video, I'm talking to you, and you know, that's in this program, so you'll see it, but I think I'm up here, and I'm talking about, yeah, it's really hard, but some of you can't even get here yet, right? Hands and knees, you're going, no way, are you kidding me? So you might be able to get here though, when you move like I taught you. And then from here, you're gonna get a pillow. Don't forget I get to move still. Have a pillow near you, and you're gonna try, because you wanna lie on your belly with a pillow under your pelvis. So what you're gonna do is use your elbow in your hands, and now you're going to start to sneak that pillow under you because your arms are holding you up. Your core is engaged. And then from here, you want this pillow under your pelvic bone to help get you on your stomach, to reduce the disc bulge and herniation, reduce the swelling. But you might not be able to tolerate it without a pillow. And as soon as you can be on your belly without a pillow, great. But for most of us, when our backs are out, that's not really going to happen. It's the sharps, you'll usually get sharp stabbing pain. But with a pillow, you're going to be good. Not too flat, not too soft, okay? So you're going to get to your side, and then you're going to use your legs, power of your legs, core's engaged, and you're going to kind of, however you have to get there, it's not going to look pretty. You're going to get to your belly. And then I just want you to try to relax. And from there, you can watch the video on being on your belly. And what it's going to say to you is the first minute is intense. You might be like, holy shit. And you're just going to, I need you to breathe. This is where you got to trust me. Breathe diaphragmatic and see if that pain doesn't reduce in about a minute or two. So I'm going to come back up and talk to you. But so getting there, again, it's not going to look pretty. It's not going to be easeful. But get on your stomach as soon as you can. Use a pillow. Use 2 pillows. I've had people come to my clinic in a wheelchair, and I get them on their stomach with first 2 pillows. And the biggest thing is the amount of fear triggers more muscle spasms. So just getting them to breathe, and then you'll see with the two pillows, like all of a sudden that back pain, that crazy seizing just starts to reduce a bit. And then once that, it's not like you're going to be pain-free. Some of you might, but for some people it might not become pain-free, but it's back to that tolerable level. And then from there, I want to take out 1 pillow and leave you on 1 pillow. Because we get just the introduction of spinal extension helps create a negative pressure to pull that disc bulge, disc herniation back in, swelling down. But the pillows under your belly is going to protect that probably irritated, inflamed facet joint in your low back. So you're going to try to get to your belly. And you don't have to lie there that long. You can start with a minute or 2 minutes, but usually once you get there and you finally breathe through the initial severe pain, you kind of don't want to move for a few minutes. So most people are going to stay here probably at least 5 minutes. And some of you are welcome to stay longer, 10. But then you're going to want to move back to your side. You can lie on your side for a while with a pillow between your knees. And then you're going to roll to your back with your knees in the Hookline position. I'm going to move freely again. I apologize, because if you're watching this and you can't move, oh my God, do you so appreciate what life was when you could move again? And you'll get there. I don't know, did I write that whole story about my bifurcated nerve? I mean, I couldn't walk. My legs were shut off from a spinal cord pressure. So it was so bad. And now I run. So, and I exercise and I do whatever I want. So I just want to say you're going to get through this. But that reminds me of another huge important point. So you're probably going to need help with shoes and socks, and getting your underwear and pants on are brutal. The more you can be here and lift a leg to put things on, as opposed to sitting, try to do more lying down. That's better, okay? And then you're not gonna stand and put on your pants. You're probably gonna, you could, because you can you have to put your pants on the floor and then put 1 foot in. Anyways, that won't be for long, 3 days maybe, hopefully, and then you'll be back to getting dressed with difficulty. My husband's got a disc herniation recently, and I've been putting on his socks for months now. So, but you'll get there, and he's actually got there, so it's been a while since I've had to put on the socks. But my point is, we've been there. We're going to get you through this. You're on your back, your knees are up, right? So you're going to do this for a while, and then you can go back to the ottoman position for a while. Then you can switch to your other side. Lying down and walking are your two best friends. And ice, of course, we talked about that. I wanted to talk about coughing, sneezing, laughing, and straining to go to the bathroom. All of those things are gonna hurt like hell. There's no way to say it. If you're in this type of severe pain, if you haven't already sneezed, then awesome, because I have help for you. But if you have done it, you probably, it can bring you to your knees. It makes grown men cry. And the reason for that is the sneezing, coughing, straining to go to the bathroom, called a Valsalva, increases intraspinal pressure, and you're already swollen down there. There's no more room, and so that increased pressure causes a nerve to be pinched, and the brain goes, oh my God, nerve pinched, we got a spasm to protect. And so there's a quick burst of quick pinched nerve and then muscle spasms, and it's like a knife sharp pain. You can help that by, one, don't be sitting if possible. Like if I was gonna sneeze right now, even to this day, sometimes I might just turn to my side really quick if I was gonna sneeze. And you're gonna do the TVA and use your hands, like keep your hands braced on something and engage your core, and then try to like almost do a limited sneeze. You're not gonna just sneeze freely and go for it. But you wanna brace with your hands. Hold on to something. If you're standing, let me adjust this. Sorry guys. Usually I have a thing that follows me, but it's not working today. So let's imagine I'm standing. I would want to get my hands on a countertop, and I'm gonna engage my core, and then I'm gonna limit that sneeze. But the more you can kind of like brace, splint, right? I'm gonna come and switch this again, so sorry. Okay, so you're trying to splint this, but that TVA activation, if you think, oh, I'm gonna cough, you're gonna engage your core, and then, well, if I was gonna cough right here, I just engage my core. But if I could get to my side easily enough, I would engage my core and cough with my hands braced. So that won't last forever. As soon as the swelling's down, you'll be able to cough again, and sneezing might be a while. It's one of the first questions I ask if you come to my clinic. Does sneezing increase pain? It lets me know how much swelling's going on, or possible disc involvement. So but you want to brace, and if you engage that core, so that's why you're going to go watch those TVA videos first things first. All right, after TVA, I start you with a movement called overhead lifts. The overhead lifts, yeah. That is a great exercise to do in the ottoman position, but it's also okay to do just in that hook line. But I just want to I'm going to get back in the position with ease, and you can have a pillow or no pillow, but I want to, let's say you're here and you've practiced diaphragmatic breathing, you've practiced TVA, but TVA, you're not probably going to be able to do a strong contraction. It's going to increase that spinal pressure. So your TVA activation, I forgot to tell you this, is also going to be partial. You're going to just begin to turn that on and brace, but you're not going to over-activate that. That will hurt you, and then you're going to go forget that TVA. But don't forget it. You just went too far. So back off, and just the beginning of pulling that belly button in, beginning of tightening. You're going to tighten the TVA. Don't forget. It attaches all the way up here on these lower ribs. So there's muscle fibers here. So I can pull this in as well as down here in. And it's just this kind of cinching inward towards your spine, not out. Out will increase intraspinal pressure. So you're not going to push out. You're going to pull in just a little until you can go further. So when you're on your back practicing TVA, the first one might not be that intense. It might just be, I'll take a breath in, breathe out, and as you breathe out through pursed lips, begin to pull the, just tighten right through here, just a hair. It's better to do on an exhalation. See if you can hold it for a few seconds and then relax. You're not moving your pelvis, so it's safe to do. You're not moving your back. It's also safe to do because you're non-weight bearing, but you're gonna activate your core. So watch that video, but you've already watched that video, right? You pause this, ramble, but I'm just kind of reiterating some points is that you're still only gonna be able to tighten a little before the back's like, no man, that's enough. And that's okay. Practice holding it for 10 seconds and see if you can breathe easily while you have that little bit of tension. And as the day progresses, you're going to be able to tighten a little bit more and tighten a little bit more. And then the more you can get that brace around you muscularly activated, the easier you're going to be able to move. And you'll be able to brace with coughing, sneezing, change of position. Each repetition, whether it's overhead lifts or pelvic tilts, you're just trying to coax permission through the spine, coax the muscles free. So you're just going a millimeter further, and then you feel that pull and you come back, or you start to feel that pain, and it might be a sharp pain. And what are you going to do when you feel sharp pain? Take a deep breath in, which is the opposite of our reaction, is to hold our breath when we get knife pain. So I'm going to try to break that habit and help you break these muscle spasms. So partial motions, that's what I mean by that. And I know this video is so long, so I'm going to stop and make another video